Okay. Welcome to the meeting of the Sandwell Health and Wellbeing Board, which is being live streamed on Wednesday, the 31st of March. The meeting will be conducted virtually via Microsoft Teams in accordance with the local authorities, police and crime panels, coronavirus flexibility of authority and police and crime panel meetings, England and Wales regulations 2020. I'm Councillor Maria Cronton.
Sorry, Chair, could we just stop for a moment, please? I don't know whether there's any sound on the recording. Just bear with us a second.
Shane, it's okay.
Oh, it's okay.
Sorry, lady.
Okay, can we continue?
Yes.
Okay, right, so please can all the attendees mute their microphones unless they have been invited to speak. If anyone wishes to speak, please use the raise hand feature or send a message using the chat feature, and I will invite you in turn to turn on your microphone at the appropriate point. When you are finished speaking, please remember to turn off the microphone again. Before we start, I will ask each member of the board and officers present to introduce themselves in turn. Okay, so I've introduced myself, so the next one is Councillor Alcock.
Councillor Keith Alcock, Cabinet Member for Homes.
I believe we've had apologies from a couple of councillors, so I'll go on to Dr. Sykes.
Hello, yes, I'm Dr. Ian Sykes. I'm a GP in Sandwell, and I'm for the one day only. I'm Sandwell and West Birmingham CCG Chair, but that will cease to exist tomorrow, and I will be able to inform you of that in our update later on in the programme.
Oh, okay.
Thank you.
Dr. Hallen, have we got? Can't say that we've got a Dr. Hallen. Dr. Ahmed? No. Michael Carolan?
Michelle Carolan.
Oh, is it? Oh, sorry, I'm not really looking at it properly. Sorry, Michelle, I apologise. Michelle.
That's okay, don't worry. I
do apologise. I just glanced at it and didn't see what was there, did I?
No, that's absolutely fine. I'm sure you've got a long list in that and names that you're trying to go through, so I feel your pain. And apologies at my cameras. I'm having some IT glitchy, so I'm on the phone at the moment, so I haven't got my camera, but hopefully I'll sort that as the meeting goes on. So I'm Michelle Carolan. I'm the Managing Director for the CCG. Thank you.
Thank you, Michelle. I'll never get that wrong again. John Taylor.
Thanks, Chair. John Taylor from Health Watch Sandwell, and I'm the Chair of the Board. And apologies from Alexia, our manager, who's had to go to an urgent medical appointment.
Okay, thank you. Hope that your manager's okay. Catherine Wilmot.
Afternoon, I'm Catherine Wilmot, Interim Director Adult Social Care at Sandwell Council.
Hey, Catherine. Leslie Hagger.
Oops. Hello, Leslie Hagger, Executive Director of Children's Services at the Council.
Thank you, Leslie. Marsha Foster.
No, I think Marsha did tender apologies. She may be a little bit late.
Okay. Do we have a Dr. David Carruthers? I'm just trying to see. No, can't see. Mark Davis.
Hello, Mark Davis, Chief Executive at SCVO, Voluntary Sector Umbrella Organisation.
Hi, Mark. Matt Young. Have we got Matt Young? Okay. Francis Craven or Emma Taylor. Have we got either of those? No. Okay. Claire North.
And Claire North, an Interim Health and Wellbeing Board Project Officer.
Thank you. Chris Guest. We've got Chris Guest. Can't see.
You
Chris
have.
I have.
Good afternoon.
Chris.
I'm Chris Guest. I'm a Service Manager within Adult Social Care with responsibility for commissioning.
Okay, thank you, Chris. Paul Mosley.
Yes, hello. I'm Paul Mosley. I'm the Better Care Fund Programme Lead, and I work with Chris Guest.
Thank you, Paul. Okay, we'll now move to the agenda. Do we have apologies? I can see that I've got some here. Democratic Services, Steph, have you got the apologies?
I've got the apologies, Chair.
Oh, Shane, thank you, Shane.
Councillor Underhill and Giles and Ian Green send their apologies.
Okay, thank you, Shane. So we move to agenda item 2, members to declare any interesting matters to be discussed. Do any members have anything to declare? No, doesn't appear so. Can we agree the minutes of the meeting held on the 25th of November? Have we got any objections?
All fine with me.
Okay, lovely, thank you. Okay. Are we all happy with that? Are they a correct record? Is everyone happy? Dr. Sykes?
Yes, I'm happy to vouch them as I was chair on the day of the meeting. Yes, I'm happy that they're a true and fair representation. Thank you, Councillor.
Excellent, thank you very much. Okay, so they're a correct record. We will move on to agenda item 4. 4.1 is COVID-19 Sandwell's position and update from Lisa McNally. Lisa?
Thanks, Councillor Crompton. Right, so I'm just going to share my screen so you can see my presentation. Can you see that okay?
Yep.
Yes, we can see that.
Thank you. Okay, so I will keep this relatively brief. Looking back over the last quarter, this bar chart probably illustrates best what we've seen, which is actually one of the fastest declines in infection rates in the country, which is obviously great to see, and a lot of credit has to go out for this to our community, whether it be our voluntary and community sector, our faith leaders, and residents themselves who don't actually get a lot of protection in Sandwell from lockdown. A large number of our residents obviously still have to go to work, and in fact we've got significantly more people working in occupations like machine operators and processing plants than even the West Midlands or England averages. So lockdown, I guess at best, presents limited protection for people in Sandwell, yet still they've achieved that significant decrease in case rates. So a real shout out and testament to those community leaders and community influencers that helped us get the messages across at the time that we needed to. We're obviously an area that's vulnerable, just like any other area, with high rates of deprivation, high urban density, and of course we have a really rich cultural diversity in Sandwell, and we know that certain ethnic groups are also more prone to be impacted by COVID. So Sandwell is vulnerable, and to see that fall in case rates is a testament to everyone involved. This just really compares the maps. We produce a map every day of the week, looking at cases around the area, and you can see there the comparison between the first week in January to mid-January and mid-March to late March. There really is a significant difference, not just in the numbers of dots on the map, but also in terms of the dark green shading, which indicates a longer term prevalence. So we really have come a long way. And at this point, I want to also send a shout out to all of those officers who, man or woman, the COVID-19 outbreak response cell. We staff that 7 days a week, 365 days a year, and it's public health staff, public health consultants, one of which is always on call, along with colleagues who work in our care homes, like social care colleagues in education, are always there to be able to snuff out outbreaks. And at one point, we were dealing with well over 3,000 cases a week back in January. There were some dark days, some dark nights, and we're forever grateful to all my colleagues who worked in that COVID outbreak cell with us. One other lesson I think we've learned in terms of communications and engagement, which I wanted to flag up, is the need for localization. As we've seen this very positive decrease in cases, we have of course seen areas surge. We'll see an individual electoral ward have a surge in cases. And what we found is when we engage with people at that more local level, we get much more traction, we get much more engagement, and people really sit up and listen. And also I think about big shout out to people in the local media who have really helped us achieve this by giving us that voice into local areas. So what we've moved from is, instead of putting out a headline saying Sandwell's case rates are going up, as you can see there, we've dealt with surges in Tipton Green, Smethwick, West Bromwich, and we actually have a press release going out again today about local areas, and it's been very effective. We can see the engagement that takes place, for example, on social media with these articles, as opposed to a more general Sandwell area. So a reminder of how people identify with place, I think, and we will continue to utilise this method because in each case it's proved effective in bringing case rates under control in each area. Also, some mention of our care homes. I know it's something Health and Wellbeing Board colleagues will always be very interested in, is how has the pandemic affected our care homes? Now, I'd probably draw your attention, because of its ease to read, is the bottom graph, which shows weekly cases. And you can see how in January we started to peak towards the end of January, but I'm happy to report that now cases are significantly decreased in our care homes. But of course, the bottom line is deaths, and every single death is a tragedy. I'll never forget for the rest of my life, I guess, how it felt last spring, about this time last year, actually, going into April, when we see so many deaths in our care homes, and working alongside adult social care colleagues and, of course, the care home staff themselves was inspirational experience, but also a very hard one. And every life we lost was a great tragedy. However, looking at the big picture, you can see Sandwell has seen fewer deaths per population in the care homes compared to other areas, which again is a testament to the joint interdepartmental and interagency effort that was involved there. Other strong partners in that, of course, were our CCG colleagues and Sandwell and West Birmingham Hospital Trust, who in particular did a marvellous job of proactive testing. So I want to show the graph again, showing weekly case rates over time, but this time I think I've done enough optimism now for one presentation. And I just want to draw your attention to the very far right-hand side. The decrease has stopped, and in fact, we're starting to see case rates just very slowly rise again. When you spend as much time staring at data as me and my team do, you get a feel for these things. And our message very much is we're starting to see case rates rise again. And as we move out of lockdown, and especially as the sun continues to shine, we are going to see more social interaction and more case rates rising. You can see really the case rate rise started to happen towards mid-March, and of course that coincides with the return to full opening within our schools. And if I can show you the age groups there, most recently, if I draw your attention to the bottom of the graph, not the very bottom, the toddlers, but the 4 to 12s and the 13 to 17s, you can see a significant increase. Firstly, in mid-March for the teenagers, when they first went back. To be honest, that in part, in fact, largely was due to the enormous testing drive we did at that time. But you can see more recently, both primary and secondary school are starting to creep up. And our outbreak cell has been very busy this week with teachers. And, you know, personally, I've taken calls from head teachers at 9, 10 o'clock at night when they've been notified of cases to get them ready for whatever they need to put in place for the next morning. So that in itself is something to take note of. And of course, when we see case rates rising in younger groups, what tends to happen to this heat map, as it's often called, is that the case rates start to blare upwards into the older groups as we see infection travel out of the younger people towards older adults in particular. And finally, I just want to end on vaccine. Sandwell is a place, for reasons I mentioned earlier, that you may predict that vaccine uptake would be low. And in fact, if you look at past data on, for example, the flu jab in Sandwell, the vaccine uptake rates are indeed low. Again, I've mentioned the two factors that would drive this. Firstly, we know anywhere in the country where you find high levels of economic deprivation, you find lower vaccination uptake. And also, again, we know that certain ethnic groups also tend to have lower vaccination uptake. And that's not a Sandwell thing, that is all across the country, and it's been talked about in the news a lot. But of course, because we have this rich cultural diversity in Sandwell, it would predict lower vaccination uptake. Now, while we are indeed seeing differences between ethnic groups, you can see that overall, Sandwell is doing remarkably well on vaccination uptake. Overall, in the 65 plus group, we're at 93%, which is right up there with many more affluent areas around the country. So again, a big shout out to NHS partners, public health, adult social care colleagues have done a wonderful job increasing vaccination uptake amongst care home staff, which has been a recent challenge. And indeed, we've had help more recently from the unions. My colleague Valerie and I did a Facebook live broadcast to union members across the Midlands, actually. They got the Sandwell Public Health team to do vaccination presentations for the whole of the Midlands, and I think, judging by the feedback, we changed a few minds there as well. Probably the flagship programme in our vaccination work is our community vaccination leaders programme. We're now up to about 170 people that we've trained up, all people who live in the heart of Sandwell's communities, from every ethnicity, every socioeconomic group, every occupational group, voluntary sector leaders, importantly, a lot of faith leaders who have been absolutely outstanding in our public health work this last 12 months, all training up to influence and positively raise awareness of the need for vaccination right in the heart of the community. We support them not just with training and organised peer support sessions, but they get written information in the form of a toolkit, plus access to funding and to council services like printing or graphic design, or of course our brilliant comms team are always ready to help them get their messages out. So it really is about taking the important news and important information about vaccination right into the heart of communities. And so, if I may, Chair, I'll go straight into item 2, because if I didn't, I'd just repeat myself, and there's not much more to say because I've covered some of the main elements of it. But item 2 talks about the local outbreak management plan.
Yeah, thank you, Lisa. That would be very helpful.
Yeah, so the local outbreak management plan, something that all councils have been required to publish, affectionately called the LUMP. And so every council is running around now organising its LUMP, and we've done ours. Again, a collaborative effort from lots of people around the system. After it's approved, hopefully, by this Health and Wellbeing Board, it will be online at that URL, at that address, and we'll promote that address. And if I just show you the content, you can see a lot of the things I've just been talking about. It goes through everything from our governance, how we organise ourselves, through to how we use data, intelligence and insight, how we respond to outbreaks. That I apologise in advance if you're going to thumb through this for some light reading over Easter, you might fall asleep. There's a lot of technical detail in there, but we like it. Supporting vulnerable groups. Contact tracing, again, something for Sandwell to be proud of as pioneers. We responded to the national system. We took the national system, which was reaching 60% of new cases, worked in partnership with the national team to create a local branch of contact tracing, and we haven't gone below 85% now for a very long time. Just shows how effective local and national can be. in partnership. Supporting vulnerable groups, there's stuff in there on homeless people, there's stuff on there on certain groups within ethnic minorities. Testing, as you know, we've just come through our surge testing, Operation Eagle, or Pigeon as we call it locally, an amazing response from the community to that. Our amazing comms team, we talk about that and how they have been just always on the front foot with engaging proactive communications, vaccination and enforcement. And it's all there. Now, the lump has to go through a regional assurance process, which is essentially people in the Department of Health looking through it, judging it against a set criteria and seeing if it's up to scratch. And I'm glad to say I received the email back only a couple of days ago to say that it is, they've called it a strong and detailed plan, many positives, which I won't read through. And that they say at the end, it's a plan to be really proud of. So we're through that assurance process now. And if Health and Wellbeing Board are happy to, we can publish the lump on the council website.
Okay, thank you for that, Lisa. It is recommended that the board agree the local outbreak management plan for submission, subject to any suggestions or amendments at today's meeting. Are there any suggestions or amendments, or do we wish to agree? I can see one hand up.
Yes, Chair. Just to endorse what Lisa's done, I have read the report. I have contributed very slightly. I think it is an excellent report, and as Chair of the CCG, I'm very happy to recommend that Health and Wellbeing Board should approve it today. Thank you.
So are we all happy? Just put your hand up if you're not happy. I think is the easiest way to do that. Okay, I can't see any hands going up. So that's excellent. That report is approved then. That's really good news. So we move on to agenda item 4.3, which is BCF update and section 75 agreement. And I think that's Chris. Yes, that's Chris. I can see her face.
Well, it is sort of me, but we've agreed, Paul and I, that as I've got a couple of agenda items later on, and you might be bored with listening to me, that he's going to present this item, but I am here to take any questions if you'd like me to at the end. So over to Paul.
Okay, thank you, Chris. So in September, Chris and I presented to the board an overview of the Sandwell BCF programme. And since we last met, the programme has continued to support the local delivery of key national health and social care priorities. In particular, the individual members of the BCF programme team have worked alongside public health colleagues to support our care providers during the pandemic, as well as ensuring compliance with national COVID-19 reporting requirements. In terms of the programme itself, national BCF policy sets 4 national conditions that areas must comply with each year. Now, firstly, that BCF plans must be jointly agreed between the council and the CCG. However, for this year, there were no planning requirements set due to the pandemic. And by this year, I am actually referring to the year 2020-21 rather than the coming year. So this is very much a retrospective endorsement I'm seeking here. So instead, there was an expectation that areas would continue managing their BCF programmes in line with the most recent BCF policy published in 2019-20, and to meet actually the remaining national conditions. The first of these conditions requires us to spend just over 61% of the CCG's contribution to the BCF on social services, and that's equivalent to a target of around £16.4 million this year. And in fact, we expect to spend over 17.6 million on social services this year, which is just over 65% of the CCG's contribution. So we've certainly exceeded expectations in terms of investment in social care. The next condition is that areas must agree to invest in CCG commissioned out-of-hospital services. And for Sandwell, this includes services such as intermediate care and GP support to our care homes. In financial terms, just over 28% of the CCG's contribution to the BCF should be spent on CCG commissioned services, and that amounts to a target of basically just over £7.5 million. And the CCG is in fact commissioning almost £12.9 million of services from the BCF, and that will enable us to meet our local discharge to assess commitments and reduce pressure on local hospitals, so we're massively exceeding our target as well. And the final condition is that
Sorry, Paul.
Yeah.
We can only see the back of your paper now, not you. So you just need to keep your paper down. Thanks a lot.
The final condition is that areas must have a clear plan for managing delayed transfers. And whilst it's probably fair to say that this condition is unlikely to feature in subsequent BCF policy, we know that at the time DTOC reporting was suspended in March 2020, Sandwell was number 1 in the country for reporting the fewest delays. So in relation to compliance with the national conditions, it continues to exceed expectations. And as part of the presentation that I gave in September, I explained the national requirement for all areas to have in place a partnership agreement made under Section 75 of the NHS Act of 2006. And that requires us to establish a pooled budget for the BCF programme. And this is a national condition for access to the funding, and health and wellbeing boards are required to approve the annual BCF plans and the Section 75 agreements. In recognition of the extra demands placed on the system in responding to the pandemic, the national BCF leads agreed that there would be no requirement for local areas to submit their plans for approval this year, or rather 2020-21. However, there remained an expectation that areas would still establish Section 75 agreements in respect of their local BCF programmes. As the lead for Sandwell's BCF programme, I update the agreements each year to reflect the latest BCF allocations and any relevant changes set out in the latest BCF policy requirements. Now, since there were no policy changes for this year, the only updates I needed to do for the current Section 75 agreement were to incorporate the new financial allocations and some minor changes concerning the membership of the Joint Partnership Board and the signatories to the document itself, following some staffing changes amongst the CCG's leadership team. So in terms of the BCF programme, there were few material changes to the Section 75 compared to last year. However, in March 2020, the government announced significant additional funding to local councils and CCGs to be made available via the NHS to support the local management of the COVID pandemic, and specifically to manage demand on hospitals through the implementation of the hospital discharge service requirements published on the 19th of March. Now, these requirements essentially mandated social services and the NHS to implement a range of measures aimed at ensuring safe and rapid discharge of patients within 2 hours of them being declared actually medically fit or medically stable, and also to ensure that where possible, people are assessed for their long-term care needs in the community rather than in a hospital setting. The requirements also set an expectation that the additional funding made available through the NHS should be managed through a Section 75 partnership agreement. Now, for many areas, including Sandwell, the best way of achieving this was to incorporate the financial arrangements for the new requirements into existing BCF agreements by way of a variation. Now, NHS England provided local areas with a template for the variation, so all I needed to do was tailor that template to reflect the arrangements for Sandwell, as agreed by the Joint Partnership Board. But these requirements were actually only effective until the 1st of September, when they were replaced by the hospital discharge service policy and operating model. Funding was again made available to support the implementation of this policy, but there was no requirement this time to incorporate it within a Section 75 agreement. So to conclude, the two documents I'm seeking the board's endorsement for today are the BCF Section 75 agreement for 2020-21 and the variation to it to incorporate the hospital discharge service requirements published on the 19th of March. These documents were signed off by the Director of Adult Social Services and Sandwell's Managing Director for the CCG, following agreement at the Joint Partnership Board on the 18th of June last year. The documents were also supported by the CCG's Sandwell Commissioning Committee on the 19th of November. Now, I realise that some members may be unfamiliar with the BCF programme or some of the terminology I've used here. Let's face it, it's not the most enthralling of subjects. So if anyone does have any questions or comments, I'm happy to take them.
Thank you for that. Have we got any questions or anything that anyone wants to say? No? Oh, we have. Yeah.
Hi, not a question, but Yeah, thank you. Not a question, but just a reflection, really, to say I think during the pandemic, the BCF has been real kind of pivotal in some of the great work we've done in that discharge to assess model across the whole system in Sandwell. And just thank you to everyone that's been involved with it, really, because I think it's something to really build on as we move forward now. So that was just a reflection from me. Thank you.
Thanks, Michelle.
Thank you, Michelle. Okay, now, so we could do with some recommendations here. So, number one is that the board note the content of the Better Care Fund report. And number two is that the board supports the plan and the proposed delivery of the communications and training messages across the system with local people. Now, I feel sure that you will all support that, but I'll just say, if you don't, can you put your hand up, please? I can't see any hands going up there.
Sorry, Chair. Can I confirm those recommendations? I've got three.
You've got another one?
There might be slightly different to the one that you've read out there. So,
okay.
The first recommendation then is that the board notes the content of the report and the associated Section 75 documents. The second one is that the board endorses the Section 75 agreement for the Sandwell Better Care Fund for 2020-21. And the final recommendation is that the board acknowledges and supports the variation to the BCF Section 75 agreement for the purposes of implementing the NHS COVID-19 discharge requirements published on the 19th of March. Bit of a mouthful.
Yeah, okay, so that is slightly different, but I think it's in the same flavour, isn't it? So if everyone is happy, I think that we'll move that report and the recommendations. Thank you, everyone, for that. So we'll thank you, Paul. We'll move on then to 4.4, and this is Health Wash's update on draft work priorities for 2021. I think we've got John Taylor for that. Hiya, John.
Thank you, Chair. Again, apologies from Alexia. She was due to present this and has had to go to an urgent medical appointment. So I was sent some slides about half an hour ago, so I'll give it a go. But bear with me.
Give it a go. I'm sure that will be fine.
Can people see that?
Yes, we can see that.
Great. Okay. So in the beginning of last year, we agreed as a board 3 priority projects. One around people's experience of mental health and wellbeing as a result of the pandemic. One about their experience of services going online and being more digital and remote, particularly around access to GPs. And a third project about young people's experience in setting up our Youth Health Watch. So this week our board have agreed the final reports for these projects. The first one is around mental health and wellbeing. This was a mix of an online survey, telephone interviews, and a range of focus groups with inequality focus. We develop the recommendations. They'll go out to the council and the CCG for comment before they're published in the next couple of days, and we hope to publish those by the end of April. Likewise, one around digital technology and accessing primary care. Generally, we heard lots of really positive experiences from citizens and patients around their use, often getting quicker appointments than in the past, but some issues, particularly around certain communities where English is a second language, or they've got sensory challenges, or just general access to digital IT at home. And that wasn't just about older people, but the full recommendations again will come out in the next week or so. We've also developed this year a Young Health Watch Sandwell to ensure the voices of young people are heard in the development and planning of services. We've got a group at the moment, again, all activities are online. They've been working closely with COOS. We're also arranging in April some mental health training sessions for our volunteers, and they're developing some social media campaigns and a new project for the following year. Because this year our services changed a little bit, obviously our staff were home working, we saved a little bit of money, and rather than storing that, we decided to make 4 community cash grants that would support local groups in Sandwell around health and wellbeing. The 4, we had quite a lot of applications, and the 4 we chose were on the screen there. So the 4 community trust is around children and young people gathering information around their health and social care, and they're going to produce a short film. West Bromwich Dartmouth Cricket Club is going to develop a kind of community garden where people can volunteer and enjoy local green space. Life in the Community is going to support residents impacted by the pandemic and offers low-level counselling and support around mental health. And finally, the New Baby Network offers workshops to prenatal families on developing skills. So we made those grants in February of this year, and we're working with those projects now to make sure they deliver, and we'll report on those shortly. When we come to developing each year our priorities, we look to 3 major sources of information: existing intelligence our staff and volunteers have gathered over the year, contact with stakeholders and their feedback on their plans, and a public survey with members of the public. We did this in February and March this year, and the board have met twice in March to consider these. And the 3 projects we're developing to take forward for 2021-22 is a piece of work with the Hospital Trust around hospital treatment pathways. We actually held a public meeting this morning around patients' experience and hopes around the Midlands Metropolitan Hospital, and Rachel Barlow was brilliant in that public meeting this morning. We're also developing a project around the impact on carers going forward, and I know the Health and Wellbeing Board will be bringing forward the carer strategy in the coming months, and so that's an area we feel we can align. And then our 3rd project we're planning for April onwards is a collaboration with the other 3 health watchers in the Black Country, working in partnership, obviously, with a relatively newly formed Black Country Healthcare NHS Foundation Trust to look at young people's experience of mental health and well-being. These projects we've agreed in principle. We're now starting to talk to individual stakeholders about how we take them forward and develop project plans around those. And finally, I suppose the board agreed again that we aim to work in partnership with partners in the system to have constructive relationships that work to improve services and outcomes, that we've got direct routes if we do need to escalate concerns in a relevant way and do that as best as we can in a private way, because often that gets the quickest and most effective results. And finally, to ensure that the public shape our agenda and influence the work we do. This year, for example, we brought on 3 new members of our board, all from diverse communities, to give a better gender and diversity balance on the board. So that's where Healthwatch is at the moment, Chair. Happy to take any questions.
Thank you for that, John. And I think we may well see quite a few instances where carers are struggling, and people's health and well-being and mental health. I think a lot of that will start to come forward, hopefully not too much. Any questions, anyone? Okay, no, I can't see any questions or comments. No? Oh yes, here we go, Leslie.
Thank you, Chair. Not a question, but just two comments, really. First of all, it's really brilliant to see the new baby network get that support. You know, this is a particular area of concern for us in Sandwell, and I'm sure that will really help towards us better understanding and better supporting those families. So that's great news. And secondly, brilliant to see that priority around young people's mental health. And John, certainly if you know there's anything that I can do or the Children and People's Strategic Group can do to help to support that, just give me a shout. Okay.
Thanks, Leslie. That's really, really helpful.
Thank you, John, and thank you, Leslie. We'll move on then to agenda item 4.5, the update on Knoll Resource Centre. And I think that's Chris. Yes, there she is.
Yes, I think you've got me again, and Claire's kindly, hopefully, going to share some slides, and as if by magic they appear. So I suppose I feel in a very privileged position today to be able to share news and updates about two exciting new capital developments in Sandwell, both of which are in the Rowley Regis area, and both of which have been developed with partners. So I think we're in a really strong position in Sandwell to be able to be developing whole new services in what is a difficult time generally. So the first presentation is about what we're calling the Integrated Social Care and Health Centre, affectionately known as Knoll, simply because it's been developed on the site of the old Knoll Care Home in Rowley Regis on Harvest Road. Okay, Claire. This just gives you a bit of an idea, hopefully, of what Knoll is, but fundamentally it's an 80-bedded intermediate care centre. So it's where we're bringing together both social care and health on one site so that we can support people to prevent them having to go into hospital, or to support them to when they are medically optimised, as Paul and Michelle touched on with the D2A conversation, and they're ready to come out of hospital, that we can get them out really quickly as soon as they're well enough. We can provide some reablement support for them within a brand new developed environment with all the kit and all the bells and whistles that we'd all want for the future, and that we will enable more people to be able to return ultimately to their own home and to live independently and will going forward. So what this circle shows is that we're looking to achieve those outcomes that I've just discussed. We expect that primarily that will be for older people, but we also expect that the support will be there for younger adults too. And the facility does have some special arrangements for people with dementia, and actually on the ground floor of the building there's a separate dementia unit which has access to the garden, which has been designed to support people with dementia as a sensory garden and somewhere where they can walk freely and safely. Touched on the integrated working, as I've said, this is going to be very much a health and a social care joint development. It's going to be staffed by care staff who are employed by the local authority, and nurses and therapists who have come from the acute trust. So working together, we're going to develop a whole new model of care that's about keeping people independent, about maximising their strengths and promoting their abilities to be able to get back home wherever we can and get them back on the feet, and working as well as they can within their own health conditions and the limitations that might give. So we also are looking at having absolute control here, and we think this is really critical. Currently, we commission a range of beds across our independent sector, nursing and residential care homes in Sandwell, to provide this same sort of service. I guess what we don't have at the moment is ultimate control on access to those beds, because it's down to the registered manager to decide whether they can meet their needs. But we also have less control on the actual philosophy of care and support that's offered within those facilities. So we're really optimistic that when we get this new centre off the ground, we'll have much more positive outcomes and many more people actually carrying on to live healthy and independent lives in Sandwell. And of course, by building this provision, we are releasing those beds that we currently commission in the market back into the market so they can be used for long-term placements. Okay, Claire. We've got lots of pretty pictures to share with you today, just to give you a bit of an impression of what this building will look like. We've tried to design it so that it's as homely as environment as it can be. In each of the units, they're small, they're self-contained, they've got tea and coffee making facilities, cooking facilities. We've got special facilities on the ground floor with proper reablement kitchens. We've got therapy rooms. We've got all the facilities that people would need, and obviously all the bedrooms are en suite, so that we can give people that opportunity when they come out of hospital to start to operate more independently, rather than being in a care home where they can often be supported more than they need to be supported, which builds a level of dependency, which means they're less likely to be able to return back home. Okay, Claire? This is the actual progress on site. We are on target to complete in July next year. There have been some minor delays, but now, as you can see, we've got there were mine shafts on the site. They've been sorted out, hopefully now. We've got the foundations going in, and we've actually got the steel work commencing imminently. So we expect that this building will actually start to go up quite quickly now. And we are optimistic that it will open as planned on time in July, and I think it's also fortuitous that that's in line with the opening of the Midland Metropolitan University Hospital. So we're having a lot of conversations with our friends across health services, both the CCG and the Acute Trust, about how we can line those care pathways and how we can get those models of support right, so that once the Midland Met Hospital opens, we've got the new development in Rowley open, that we absolutely align how we work together and develop some real opportunities of that truly integrated working for the future. Okay, Claire? This just gives you a bit of an idea of the process that we've actually gone through, and it has been a long time coming, I will say, but we've got the contract in place. The building work is now actively commencing. We're looking to start the recruitment of our integrated staffing team this summer. So again, that's something that we really want to move on with, because we intend to be really clear that we've got our workforce development plans in place, we've got the right skill mix within our staff teams, and that they've got an opportunity to gel and work together before we actually become to the point of actually opening this service. We've got a range of specialist equipment that we would want to be ordering, and on site we've also got a small joint equipment centre. So it does mean that we will have public access to a range of equipment that people might need at home, not only to be able to take home with them when they leave the centre, but for the community to access from that rare site. We will be moving forward with our CQC registration process so that we're clear about our service model going forward, and we obviously will have a grand opening of the centre around July next year. Not 21, it is 22. So just need to change that. Okay.
Okay.
We expect our gardens to be laid out.
We keep losing you.
I think we all agree. Sorry?
We keep losing you. You keep coming in and going out. We're missing bits.
Oh, Chair, I'm very sorry. Is it my connection that's
I think so. Just try turning your screen off a minute and just go with it. That sometimes helps.
We'll give it a go. I suppose it was just this is come to the end. I guess it's probably worth, if there's anything that people haven't caught, I'm happy to pick it up under the questions. But obviously we can also share these slides after the meeting today so that people have got something to refer back to.
Okay, that's brilliant, thank you. Has anyone got any questions or comments to make regarding the Knoll Resource Centre? No? Okay. In that case then, Chris, you can carry on and move on to the Willow Gardens as well, if that's okay.
Okay.
Yeah, okay.
Thank you, Chair, and you shout if you lose me, and I'll try and do what I can to stay with you. So again, we've got some slides now. Willow Gardens is 90 extra care flats, and if anyone has been to the site, which is at Moor Lane, which is just down from Rowley Hospital in Rowley Regis, they will see that this building is is virtually up now, so there's a lot of work that's now developing on the interior of this building, but it's going to be a really exciting new development again for Sandwell. So extra care is a way of supporting people within an environment that's safe and that is able to provide care and support on site 24 hours a day. But it also means that people have got their own flats, and within the development at Willow Gardens, we've got a mixture of 1 and 2 bedroom properties, but everyone will have their own front door, and they've got their own lounge, their kitchen, their ensuite bathroom, and obviously either 1 or 2 bedrooms. We've also got a range of communal facilities on site, including a restaurant, quite a big restaurant that's right at the front of the building, a hairdressing salon, and those facilities are going to be available both to the tenants who are living on the site in Willow Gardens, but also to the local community. So this becomes another community resource, really, and that's how we would want to promote it going forward. As part of the development, there'll be an opportunity for people to take their meals on site, that they'll be involved in activities that will be developed, again, potentially involving people in the community. So it's about that widening up and not segregating people. It's about how we make these buildings accessible to the local population that they're already supporting. Each of the flats will have a call system so that the staff who are there, they will have a care and support plan that details any care and support that they need with their personal care, for instance, but they also have this call button so that if there is an emergency at any time of the day or night, they can press that and there is a care team on site who will respond. So I think one of the real focuses, I guess, of extra care is that level of safety that people feel when they're in an environment where there is someone there if they need it, whenever they need it. So I think that's one of the biggest selling points with this scheme. Okay, Claire. So we've got a bit of a rundown here of the process that we've actually gone through. So there's a number of reports that have actually been presented to Cabinet. So the scheme was agreed in March 17. In 2019, we actually took a further report that proposed that the 2 extra care schemes that the council currently run at both Manifoldy Grange and Holly Grange, which are now dated and certainly in need of significant investment, will close. But those tenants and that staff group will have the opportunity to move and relocate to Willow Gardens. And I think it's fair to say there's been ongoing consultation with both the tenants and the staff at those Granges and really positive feedback, and they are really keen to be able to move into Willow Gardens as soon as the scheme is up and running. We also expect to open up the scheme to local residents across Sandwell, but we're particularly interested in supporting people in the Rowley area where there's a limited supply of alternative options for this supported living environment within that geographical patch. And I think it's fair to say we're expecting 32 of the tenants at the Granges to move into the new scheme when it opens, and we've already got 36 people on the waiting list, but we're also seeing quite a lot of interest from local people in the Rowley area, and we're yet to promote this scheme because obviously it's due to reopen towards the end of this year now. Okay, Claire? So again, just some more pictures. Similarly to the Knoll development, we've got an enclosed safe sensory garden within the middle of this scheme. So not only have you got the environment of the building itself, but you've also got that opportunity to use the open space within the centre, and there's adequate parking as well on site, both for the tenants themselves but also for the visitors. But I guess it's brand new. It's on a site that's previously been unused, except for a fairground occasionally and a circus. So it's a real opportunity to see a local development within Sandwell. Okay, Claire? This was in the snow, but it does show the actual building that is up, and it's I say it's the interiors now that they are primarily concentrating on. We are expecting the scheme to open towards the end of this year. We're looking at September, October, and Claire has got a virtual tour of the scheme, which I don't know if you've got time to see today, or whether you'd want us to share the link to that chair so that people can access it later. How would you want to take that forward?
Yes, Chris, I think we would like to see that. We're in front of time, so I think we would like to see that. Please.
Well, I think Claire.
Have you got it, Claire?
Yeah.
Claire's going to share that now, yeah.
Yeah, Claire's got it all in hand. Yeah. Thanks, Claire, for that. I mean, I think everyone will agree it looks pretty impressive, doesn't it? And you do have to be over 55 to get into an extra care scheme, but sadly there might be a few that might hit that criteria. Claire, is there anything else on the slides? I think we probably covered most of them, didn't we, for Willow Garden? So I think, yeah, it was just the final slide. So again, this just gives an idea of the process that we followed. I guess the important bit here is that we're looking to open the scheme towards the end of this year. We'll be relocating the tenants from the 2 Granges, as we've discussed, but we'll also be given the opportunity to new people to actually join our waiting list and to enjoy the facilities at Willow Gardens going forward. So thank you for your time today, Chair. And if there's any questions, I'm happy to answer what I can, but I might have to bring Claire in to answer some of the technical details because she's also been supporting these developments.
That's fine, Chris, thank you. And it did look impressive, I must admit. Dr. Sykes.
Thanks, Chair. Yes, I would agree. It does look very, very impressive indeed. I wondered, is the accommodation essentially short-term or long-term? And presumably the residents therefore just essentially rent the accommodation off the council. I just wondered if there was anything linked where it actually links to the unit we've just seen, where people might, for instance, I can think in particular about long COVID, where they might have to go for extra rehab, then they might move into somewhere like the Willows as a way of hopefully actually enabling them to get back home, or is this essentially regarded as a long-term permanent solution for those who are, I suppose, more disabled?
Yeah, Willow Gardens primarily is long-term tenant or accommodation and move into there as a tenant of the council, so they would be a council tenant going forward. What we're looking at is...
Chris, you're breaking up again. Sorry, you're going to need to turn your screen off. You just keep breaking
use
up.
Some of the flats for Sorry, Chair.
No, it's okay. It's just that it breaks up. Try again.
Okay. So we are looking to see if we can designate some of the flats for reablement, because we use some of them currently at Manifoldia Grange, one of our other Granges, to support people who can go home but need that extra level of support, really, that wouldn't require them to necessarily be in a residential setting like Knoll, but who can still have some flexibility to operate independently with, again, a view to going home. So we are planning to include, where we can, a number of reablement flats within mix of those flats at Willow Gardens, but primarily it will be for long-term tenants.
That's great. Thank you.
Thank you, Dr. Sykes. Thank you, Chris. Okay, so we'll move on to agenda item 4.7, which is the CCG updates, and back to Dr. Sykes.
Wow, I've come around a bit quicker than I thought. Thank you very much, Chair. So just to say, as a general update, first of all, as we move into the brave new world, so I'm actually Chair of Sandwell West Birmingham CCG, and this is my last day as Chair. So Sandwell West Birmingham CCG will cease to exist from this evening, and the new Black Country and West Birmingham CCG will be in place from tomorrow. In fact, we do have a governing body meeting tomorrow where we'll have to approve all the policies. So from tomorrow, it'll be the Black Country and West Birmingham CCG, which will have one CCG. It has also been given its ICS, which is I don't know what it's called now. That's the Integrated Care System status. So it has been given Integrated Care System status, although that doesn't actually have any legal right at the moment. That's what I suppose the STP, Sustainability and Transformation Partnership. So that's the new CCG, and there'll be 5 places, and Sandwell will be one of those places. I would like to think that for the residents of Sandwell, they won't actually notice anything different at all. I would like to think actually it gives us greater opportunities, hopefully, to develop more locally based commissioning. And of the new Sandwell place, as I say, this is the one place as part of the CCG. There will be the place-based committee, and I will be myself. So I will be the chair, the clinical chair of that place. Dr. Pre Hallen will be my vice chair, and there'll be 6 other PCN representatives. So there are 8 PCNs within Sandwell. Each of the PCNs will be represented on the Sandwell Place-Based Commissioning Committee, and Michelle Carolan will be our managing director. It's an opportunity, therefore, to say thank you and goodbye to Dr. Ayaz Ahmad, who was one of the Sandwell GP governing body members, who therefore finishes terms of office today, but won't be one of the place-based leads. there's an opportunity to say goodbye to him, and hopefully this will be an opportunity to really develop local commissioning, and I hope actually to continue to develop the really close working that we've developed through our close working as a result of the pandemic with local authority. So we hope that we will get some sort of initially shadow budget, but we will actually have some element of devolved budget, which will allow the Sandwell Place-Based Commissioning Committee to work with the local stakeholders, including local authority and Health Watch, to actually be able to commission or help to develop commission services which are needed for our population. So essentially that's the way the things are going. There's also just an opportunity to give a very brief update on the vaccination programme, and interestingly at the last Health and Wellbeing Board, which was in November, we were talking about how we were very hopeful of setting up vaccination schemes very quickly. So that was at the last Health and Wellbeing Board only 4 months ago, and in fact the first immunisation was delivered from one of our PCN networks on the 15th of December. And within a matter of a few weeks, we had 4 local vaccination sites set up, all delivering vaccines at the beginning of January. And in fact, in Sandwell as a whole, we've delivered, I think, now over, so to put it in perspective, we talked about percentages and figures, but actually over 120,000 people have received their first immunisation in Sandwell, and around 60% of those were delivered from our local general practice centres. Subsequently, of course, we now have the mass vaccination site at Tipton Sports Academy, and we now have several pharmacies also able to deliver vaccination. So just an interesting reflection and a fantastic effort on where we were in just 4 months. So that's essentially what's happening with the CCG. I'll stop there and take any questions before we move forward to the big brave new world from tomorrow. Thanks, Chair.
Thank you for that, Dr. Sykes. Have we got any questions at all? I can't see any questions. I would like to say thank you to yourself, however, for the role that you've been carrying out up to now, and all the best for your new role that I'm sure you will carry out with just as much enthusiasm as you have done this present one. And also to Dr. Ahmed as well, I'd like to say thank you for his contribution also.
Thank you very much, Chair. And what I'm assuming is we don't quite know how the structures will carry on, but I'm working on the assumption that in terms of health wellbeing representation, you'll see very little change. I'm working on the assumption that with myself attending as the place chair, Michelle as managing director, and probably Pri Hallen as the vice chair of the Sandwell Place. So hopefully, therefore, actually very little change from a CCG perspective, which will hopefully continue to maintain the great working relationship that I think we've managed to develop. So thank you very much.
Okay, thank you for that, and I'm sure going forward we will all manage to work together with just as much enthusiasm as we have up to now. We move on then to agenda item 5.3, which is the board's forward plan, and hand over to Claire Norton to provide that update, I believe.
Okay, so we've got a forward plan for the new municipal year with our next meeting scheduled for June. So far we have 2 items on that agenda, which are the Sandwell Carers Strategy for Catherine Wilmette and Suicide Prevention for Diane Millichamp. We also have we have one item, that's not yet allocated for award, which is improving palliative and end-of-life care for Dr. Locke. So it's a request, please, for any items that people would like to add to the forward plan for the new municipal year. Whether people can send me those in an email or you'd like a discussion now.
Okay, is there any questions, discussion? No?
Perhaps
Okay.
Chair, send them through to Claire.
Yes, I think, yeah, send them through to Claire if there's anything. Okay, well that didn't take very long, we've done rather well there, haven't we? Before we do close the meeting, I would like to say thank you to Shane Parks, who is our Democratic Services officer, who has been working for this board for a number of years now, and Shane is moving on, shall we say, from this board, and I would like to wish you all the best for the future, and you can go and enjoy some garden time, I think, Shane. That'll be very nice for you.
Thank you very much, Chair. Yes, it's early retirement.
You're very quiet, Shane.
Early retirement, Chair, so very early retirement, I'll add.
Yeah, it's very, yeah, you're very quiet. Shane, I've known you for quite a while and you've always been hugely helpful. So personally, I would like to thank you very much for all the assistance I've received from you over the years in many other things.
Thank you very much. Thank you very much, Chair. Thanks, everyone.
That's better when you got the mic down. That's great, isn't it? Smashing. Thank you. So, the date of our next meeting, it would appear, will be on the 16th of June. So I hope everyone keeps safe between now and then, and I'll close the meeting there and look forward to seeing you on the 16th of June. Thank you very much.